yourself.
Hi everyone. First of all, welcome and thank you for joining the second session of our webinar series. On behalf of the Youth Health Forum's Youth Leadership Group, I'm really excited to have you all here today. My name is Zainab and I'm one of the Youth Health Forum Young Leaders. I'll be hosting and moderating the chat today. I would first like to begin by acknowledging the traditional owners of the land in which we are all joining this meeting from. For myself in Perth, that is the Whadjuk Noongar people. I would like to pay respects to elders past, present and emerging and acknowledge that sovereignty was never ceded. This week is Young Carers Week, so I would like to give a shout out to any young carers who are joining us today. We would like to say that we recognise and celebrate your contributions. This webinar is the second in a series being put together by CHF's Youth Health Forum. The webinars will explore 4 topics selected by the Youth Health Forum that are of particular importance to young health advocates interested in improving Australia's systems and advocating for specific causes. Many of the topics are areas that we wish we had known more about when we began our advocacy journeys. Today, we'll be talking about Advocacy 101. So we've invited 2 people who've entered politics at a young age to share their experiences and what they've learned with us. The aim of this webinar is to help you understand better ways that you can have your issues addressed. We have already received some great questions in advance. However, this is an interactive webinar, so we have lots of time for questions with our expert speakers. I really encourage you to post any questions that in the chat below. Myself and Carolyn, our wonderful CHF policy officer, will be monitoring the chat as we go through. Any sources or slides or resources will be available after this webinar. Just for a bit of information about the Youth Health Forum. So for anyone who's never heard of the Youth Health Forum and is joining us for the first time today, the Youth Health Forum was launched in 2018 by CHF to increase youth representation in advocacy spaces and to better represent diverse health users. Youth Health Forum members are aged between 18 to 30 from across Australia with diverse backgrounds, identities and lived experience. There is a wide range of knowledge about health services, involvement with NGOs, community sector and engagement with local issues. The Youth Health Forum has been funded by the Commonwealth to provide advice and leadership in youth health policy and to equip all young people with advocacy skills and knowledge to be meaningfully involved in discussions about our future. I would also like to just take this opportunity to thank our partners, Origin Revolution in Mind, who have generously supported CHF's young leaders to design and deliver this webinar series. We appreciate Origin's ongoing investment in young leaders and advocates, their commitment to meaningful co-design with young people across evidence-based research, policy development, and clinical care, and acknowledge the high standard that you set for organisations working with young people. So to begin this webinar, I would like to introduce Senator Steele John. Jordan is Australia's youngest senator and is the first person with a lived experience of cerebral palsy. He has dedicated his time to youth and disability advocacy, studied politics at Macquarie University. Jordan has been involved with the Greens Party since he was quite young and entered the Senate in 2017. He is really passionate about acting on climate change, reducing youth unemployment and implementing a full NDIS. He is well known for speaking up on the lack of women, people of colour and people living with a disability in our parliament. We are very pleased to welcome you, Jordan, and are keen to hear about your story. Thank you.
Thanks so much, Zainab. And I think for some reason, it might just be on my end, but I'm apparently Carolyn for our time together. I have no idea why I'm Carolyn, but I'm going to roll with it anyway. I would like to acknowledge, of course, that wherever we are coming together from lands of First Nations people. Like Zainab, I'm on the land of the Whadjuk Noongar people, and I'd like to pay respects to elders past, present, and emerging, and acknowledge that sovereignty over the land was never ceded, particularly when we consider the intersection of First Nations issues and the healthcare system more broadly. We see that there is so much work to do. And so much unfinished business that we must get on with as a community together. It's a real pleasure to be with you all this afternoon or this evening, depending on where in the world you are. I would like to apologise again for the rather shaky nature of my audio stream to you all. I've had a home internet crash out, and having to kind of jerry-rig this thing through my mobile. I'm also in a room surrounded by furry friends, and they'll probably, knowing them, start yapping at some point during our conversation. So you'll have to forgive them for that. I just want to briefly take you through three things that I've found to be really central to advocacy in my time in the Parliament. In case you don't know, but as Zainab said, I am a federal senator for the Australian Greens. I was the youngest person when I was elected to be elected to the Senate, and I was the first person with a disability as well. And there's a lot of work that needs to be done in the intersection of youth and disability, and in my time in the place, but also way before that as well. I've been kind of building and experimenting with what works and what doesn't work in advocacy, in activism, and in organising as well. I think there's three things I've learned in that time. Firstly, that if you're going to do something, if you're going to advocate for a change, then your starting point needs to be the building and establishing of a campaign. Now, that might seem like a pretty basic initial observation to give you, but in my experience, many organisations that set out to actually achieve a change aren't really clear on the fact that they are starting a campaign or what a campaign actually is when they begin that journey. They might start out articulating that they are about to begin a campaign, but then the plan actually talks to you of a, solely of an effort of, say, lobbying directly MPs or getting a number of ads in the paper, which are in fact campaign tactics, but they are not a campaign overall. A campaign is grounded in in my view anyway, is grounded in a vision, a clear vision of the change that you want to see, a clear idea of what the change you want to see. It is articulated in the form of a number of very kind of well-structured strategies that you have designed to take you from where you are to where you want to be, that include a number of different markers along the way that will tell you if you're actually working towards your goal. From those strategies will then drop down a bunch of interim goals that you will want to achieve along the way. From those will drop down a bunch of tactics that you will need to undertake, like it may well be, lobbying an MP directly. And then below that, you will have the resources that you will need to action those tactics that support the accomplishment of those goals, that feed into that strategy, that then achieves your vision or overall purpose. And as part of building a campaign, you can't do any of it without other people. And I really can't emphasize this enough. You've got to build your campaign, and as part of that campaign, you need people to come with you. You need to be constantly thinking about how you bring people into your campaign, bring people into the work that needs to be done to achieve that ultimate goal you're shooting for. Which brings me to the second piece of advice that I'd have, which is bring people in. Make sure whatever you are doing as an advocate, as part of a broader effort, make sure that you are doing it with other people, like with a large group of people, and there is a plan to grow that group larger. Because advocacy, if it's systemic advocacy particularly, will often take either a period of time, although we should always be working with urgency, and we should be cognizant, I think, of that observation of Dr. King's around the supreme urgency of now. We need to build sustainable campaign structures as advocates to ensure that we can go the distance and push back against our opponents when they push back against us. So you need other people with you to do that. And that looks like making sure you have good management structures and good check-in processes and all of those things. But it also looks like giving people a clear pathway from complete absence of knowledge about the issue you're trying to address through to actually being able to get interested, get active, get in, help your campaign to succeed. Having a volunteer pathway as part of that is really important, because ultimately you need as many people with you as possible to bring the pressure to bear that you need to achieve your campaign, your campaign purpose. Which brings me to the third piece of advice that I'd give you. Never assume that if you decide that your lever that you need to pull, or the action that you want to see, if that requires a MP or a political party to make a change, or if it requires a corporation to make a change, or even really anybody, like any entity, whether they be non-government, government, or corporate, never assume that you will succeed or fail based purely on the logic of your argument. It's a very hard lesson to learn, but I have, over the last 4 years, come to the very clear view that politicians and organizations and corporates, when they are resisting change, they actually don't care about how good your argument is. They care about the size of the stick that you bring into the room versus the size of the stick that they will be hit with if they give you what you want. And so your aim as an advocate needs to be to move into that room with the biggest possible stick, with the most people behind you that you can, with the biggest ramifications that you can muster for not acceding to your campaign demand as possible. So that is really, that isn't to say that there aren't caring people in those roles. There are, but in my experience, I've never met anybody yet that cares more about a really compelling argument than they do about the continuation of their political career or their promotion to a higher pay grade or those kind of things. So you've got to bring your people, you've got to bring the number of emails you've gathered, the number of people that you'll be able to speak to about the outcome of this interaction, say, into the room to actually get their attention and get that change happening. So that is really important. I'll just say, some of you might be thinking as well, well, I'm thinking of moving towards more individual rather than systemic advocacy. How do these three ideas, how are they relevant to what I might want to do as an individualized advocate? And I would say that they actually broadly are. Like the difference is scale, right? If you're advocating for an individual, you still need to follow those steps in a process of identifying really clearly the change that the individual needs, what needs to be addressed, and that you have seen the totality of the problem they are experiencing and identified the ultimate root, like the root cause of it for them. You need to bring them and their support networks with you in a process of advocating for that personal change, and that needs to be one that is finely balanced among the very complex interpersonal relationships that can exist around an individual that is in distress and need of advocacy support. And then ultimately, as you're working through that process, you need to bring on behalf of that individual the biggest stick that you possibly can to the meeting with the person that needs to change their activity or provide that person with a service, because they've got 100 cases to see after yours, but about 100 different individual issues, and you've really got to make yours sound the scariest, the most urgent, the most need of actual action, because otherwise you'll get put to the bottom of the pile with the, oh, it's not really burning that badly people. So I think they are very transferable elements as well. All right, well, I hope that's been useful. I can't actually remember off the top of my head how much time I was allocated, and I was planning to read that off the phone as I was doing this over the computer screen. So have I undershot or overshot?
So it was 15 minutes, so that's pretty good.
Lovely. All right, well, I'll leave you there and open up to any questions.
So we had one in the chat from Jasmine. She says, I'm honestly astounded by the wisdom and insight you have into advocacy, Senator Steele John. I often struggle with imposter syndrome as a young person in the advocacy political space. Have you ever faced similar doubts, and how did you overcome them?
Oh, awesome question. Was it Yasmin? It broke up just as, yeah, awesome question, Yasmin. All the time. Imposter syndrome is the fellow traveler of most people of our age, I think. And it's because we exist in a society that is incredibly discriminatory towards young people. The dismissiveness, the disdain with which our contributions are often received by older folks, it's like so normalized, and you can't help but imbibe those narratives and sometimes buy into them. I think what I would say is what I've learned from being alongside a significantly older cohort of people in Parliament is that there absolutely is no ironclad correlation between age and wisdom, and that if whatever space you are in, whether it be Parliament or a roundtable discussion formulating policy in relation to health practice or anywhere in between, what will contribute most effectively to good outcomes for people is a diversity of voices and lived experience around that table. So, like actually health outcomes, for instance, they're really bloody poor if they're if the processes around them are shaped by old white men in swishy white coats. That doesn't actually lead to a good outcome. So it's about turning that conception of yourself into as a young person, and turning it actually into a strength, and leaning into the fact that, yeah, you have lived your life in a certain way. This is the perspective you bring, and it's just as valuable as anybody else's in that space.
We have another question from Georgia. If there was one youth or health issue that you could wave a wand and solve, what would it be?
Oh, one health or youth issue. All right, I can't give you one. I've got to split it in half. For specifically for disabled people, it would be to institute the fully the recommendations made by the New South Wales Intellectual Council of Disability in the lead up to the 2016 federal election. They came out with a bunch of initiatives, really simple, that would improve health outcomes for intellectually disabled people. We know that intellectually disabled people have a life expectancy about 26 years less than the rest of the population, and that is driven primarily by really poor health outcomes when ID folks interact with the system. So that'll be one. The other one would be a health-driven approach to drugs and alcohol. I'm really sick of every festival season wondering if one of my friends will be frightened by a dog at a festival and accidentally take too much of a substance and die. Like, that's not a thing that should be a thing. Yeah, so I would certainly like center drugs policy around health. Treat drugs like a healthcare issue. Wow. That would be my radical thing, because it's one of those really sad examples of, we absolutely know what the way forward is on this. We absolutely know the evidence is in. There is no benefit to a criminal justice approach to illicit drug use. The only barrier is political, and in between where we are now and where we need to be on these issues, a lot of young people are going to die, and that's just not okay. It's not acceptable.
We have another question from the chat. So Nick asks, I was curious, how do you deal with power imbalance and working with those who have more power?
Really good question. Really good question. A really useful thing to remember in crafting any kind of policy process in relation to healthcare or any other issue is you've got to set up a process that acknowledges the existence and then redresses power imbalance. So particularly if you are addressing issues around, working alongside or crafting health policy or whatever with people from First Nations background or young people or coal communities, if your process does not address the power imbalance, if you're coming at it with a complex bureaucratic approach, you will, whether or not you have a conscious bias against a certain community, your system will bias towards those who already have power, because complex bureaucratic systems are their jam. They created them and sustain them. So that's the first thing that I would say. In terms of the broader thing of how do you deal with people that have got a power imbalance with you, it's really important to pick your audience. Like, I know that sounds like a bit of a kind of, here at Coca-Cola, we identify our audience, but actually what I mean is, if you're in the business of change, God, that's corporate as well. If you're advocating for change to make life better for people, you will inevitably come up against resistance and pushback from those who already have power. And in some ways, that resistance is a really good indicator that you are doing a good job. Like, I have made speeches in Parliament, and members of the Labour Party and members of the Liberal Party have gone, blah, 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 blah. That was so inappropriate and blah, 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 blah. And to me, it's like, my KPI has been achieved. Because if you people were celebrating me, I would not be doing what I think needs to be done. I would not be serving the people that I came here to serve. So one of the ways to do that is one of the ways to deal with that power imbalance is go, actually, I'm not here for you. I'm here for X, Y, Z reason. If you're going to be unhappy with me, I'm not going to think about it. I don't think about you. Like, you're not part of my metric of is your opinion important? And that wouldn't be to say that you should ever be rude or aloof or unnecessarily unkind, because then you just sink into the mud with everyone else. But keep your eye on why you came there. and why you wanted to get involved with a change. And particularly the medical profession is sadly full of bodies and boards, and yes, but haven't you heard, Dr. Carlton is very unimpressed with that thing that you said at the general practitioners ball. And it's not like, it's really not good for medicine. Like one of the most damaging things to the medical profession is the medical model of anything. Like the business model, the approach should be person-centered. And what that means is a often quite radical institutional release of power, rather than just, the corporate blah of saying the word person-centered 100 times. So yeah, if you're getting spittle in the face from a white old dude, I usually think you're doing something good. Apologies to any old white dudes following along.
We have one more question from the chat from Katie, who asks, as someone who's heading towards the top end of youth category, do you agree that moving up the youth age limit to 30?
Sorry, what was that? I lost it.
Oh no.
What was the last bit of that question?
Do you agree with moving up the youth age limit to 30?
Oh no, that's interesting. I have not heard of that idea. Can anybody give me a brief example of what the argument is, one way or another?
So I think the WHO considers a young person from 12 to 25, and a lot of the health organisations like Headspace and Origin consider that sort of the limit. And once you've reached 25, for example, you're off your parents' health insurance, although I know that's just been extended recently.
Yeah, not anymore. Yes.
A lot of youth targeted programs and services cut off at 25.
Well, look, to be honest with you, I think, look, anything that keeps people in contact with services that work for them for longer is good. But I would also say that these things are pretty arbitrary. Like, there's a lot of, you can take a lot of different views of the what the developmental research says about somebody at a certain age versus Archie, come here. Sorry. So that's all a bit, it's all a bit arbitrary. My preference would actually be, not only is it arbitrary, it's also often driven by funding requirements, and like subjective ideas of when somebody is politically cute or not. Like, you can hold a 12-year-old accountable in a certain way, but a 13-year-old, like, oh, nobody cares about. Like, the reality is, if you go to the social services space, it's so much more difficult to get a child psychological supports, health supports, you name it, once they are over the age of 12. Because then suddenly they're a shitty teenager and nobody wants to know anything about them. And that's just the reality. I've spoken to so many social workers that they always say to me, if we don't get them into a good situation before they're 12, good luck. Like, that's not going to probably happen. So really what we need to do is to redesign our services so that they follow people through life. And they don't arbitrarily assign any particular kind of need to axiomatically to age, because everybody experiences life differently at different times. Now, what does that do? That costs more money, and that's why we don't do that, because it's more complicated, and as things become more complicated, they become more expensive if you don't take into account other contextual cost factors, which our system doesn't. So yeah, I mean, I think on the surface of it, I'm 26 tomorrow, by the way. So I'm about to phase out most of the youth services, which makes me feel really old. I've been in a couple of meetings with people that are 16, and I'm like, damn, I was that 2 seconds ago, man. What happened? So yeah, for my own ego, as well. Put it up to 30, I think.
Well, thank you so much for your time. I think that's probably all the questions we have time for this evening. We really, really appreciate you joining us. There's lots of admiration and thanks coming through on the chat. Really enjoyed your presentation and all the guidance and knowledge you've shared with us. Thank you for answering all the questions on the fly, and hope you enjoy the rest of your afternoon.
No worries at all. Thank you all so much for your time as well. And if you'd like to ask me any additional questions or just follow along generally with my work, you can hit me up on my Facebook page, which is just Senator Jordan Steele John, or indeed my Instagram. I do try to answer as many of the comments and messages that come through to those platforms myself. So you'll probably get me if there was any questions you wanted to ask that you didn't get time to. All right.
Thank you so much.
Fantastic. Thank you. Have a good day. Bye.
And now I'll hand back over to Zinab. She's going to introduce Neil.
Yeah. Thank you. Thank you, Carolyn. Our next speaker is Neil Farrow, who has a background in Australian politics as he ran for a Labor seat in Victoria a couple of years ago. He was a key figure in changing the Australian Labor Party's position on gay marriage and at the centre of the work that was involved in gaining support for changing the legislation. He has a background in communications and marketing, is a former director with the Foundations for Young Australians, and is now a non-executive director with Spark Strategy, who work a lot with social sector and organisations that have a purpose or mission for change. Neil has worked with a lot of young advocates through the Foundation for Young Australians, UNICEF Ambassadors, the Sydney Myer Innovation Fellowships, and now with the Youth Health Forum. So we've asked him to share his knowledge with us today.
Excellent. Thank you for having me. The reason why there's two Neils on screen is I'm about to do a screen share because I did prepare a little presentation. So let me just see if I can get this up and rolling successfully without anything blowing up. So let's see what we've got here. So I've got a very boring slide to start off with, but I just wanted to kick off by saying a big thank you to everyone this evening, and just wish to pay my respects to elders past, present and emerging. I'm on Wurundjeri land of the Kulin Nation down here in Victoria, and it's really great to be with you. I come from a slightly different perspective from Jordan. I have ran for office on 3 separate occasions and lost on every single one of those occasions, sometimes as short as 30 votes for state parliamentary seats here in Victoria. But I was also the national chair of Rainbow Labor, which is the peak LGBTI rights lobby within the Labor Party. And my presentation today is hopefully a bit interactive, and I'm hopeful my links will work, and we'll kick things pretty much straight into it. So when I grew up, this was the kind of messaging in the world that I grew up in, particularly around marriage equality and LGBTI rights. A lot of this comes and is still let out of the US, but this was really sort of the first exposure I had to being a gay guy who came out when I was 15 around LGBTI issues and LGBTI health issues. So for those involved in the Consumer Health Forum, more generally, LGBTI people have higher rates of mental illness, suicide, and a whole heap of other health indicators that are worse off than the general population. And that stems originally from a lot of this sort of constructs that exist in society. I also grew up in a world where my parents are baby boomers, so of course they distorted the tax system to maximum benefit, and they got free education and I didn't, and they get pensions and I won't, and all those intergenerational issues that we have. But I grew up with a belief fundamentally around 2 really core values. So for me, it was around education and equality. And so Gough Whitlam is a big part about our education journey in Australia, which originally got me started in the Labor Party. So I did my research and I looked around and I came across this document, which was the first ever gay rights document of the Labor Party. Now this predates me being born. So this document, if you've got very detailed eyes, will see that it was back when Australia had sort of 6 and 7 digit phone numbers. Some of the terminology is a little bit out of date, but as I started to explore my political journey, I started to want to get involved to make change in issues around equality and education. I also came across this document. It's the first ever gay rights policy for the Labor Party. And I'll just leave this here for a moment for you guys to have a little bit of a read, just because of some of the language and to see how far we came. So from this one here, it was like, a recognition of homosexuality as an equally valid alternate lifestyle. And for those of you who don't know why the text is all weird, this was actually done on a typewriter when we had 6-digit phone numbers in Australia. You know, the government should refuse to deal with any private employer who discriminates against gays. You know, some basic healthcare, equal opportunity and rights. A lot of these things we take for granted. From a health perspective, the Health Commission to provide adequate services to the treatment of STDs in both cure and prevention, and legal rights and benefits to extend. So this was sort of my warming up into politics. I then got involved in a big way, and you don't necessarily need to hear the music, although I'm hopeful that I'll be able to work this out so you can have a bit of a look at this presentation. So let me just hold on a second, and I will swap the screen share over so we can do this a little bit differently. I will share screen. Oh, no, we're doing this one here. So hopefully you can see what's up on screen. You don't necessarily need to hear the noise of this presentation. We've just got a little ad before us, unfortunately. But I got involved really early on in the piece with this particular ad, which was, if you haven't seen it before, and it's running through pretty quickly, this was a Get Up ad that was seen and is still seen by millions and millions of people, which was a big campaign around marriage equality. It's going back quite a few years now, but it was my first experience of moving mainstream in my advocacy and sort of seeing what could happen in the LGBTI space. And this ad is a beautiful ad, and it's well worth watching. And I'm not going to spend all of the moments of it with you, but this was my first engagement through mainstream advocacy. So I had grown up sort of with issues around equality and education and got involved in the Labor Party. And then when I was really keen to get my teeth into an issue, as many of you are for CHF, I started to get more and more involved with marriage equality and more involved in issues around LGBTI rights. And this was the first ad that I helped put together, and the messaging around for LGBTI rights. It was done by Get Up at the time, when Get Up was really active in this space. And it was targeted directly at the ALP. The actor in it is a guy called Julian, who's still a good friend of mine. I just saw a note pop up on screen that this still makes me emotional. I still tend to cry at the end of this ad, even after all of these years. Julian's now a good friend. He's actually living, or he was pre-COVID, in the US and doing acting over there. But the really interesting thing about this ad is the final message at the end, which we're about to get to. So it plays a little part. But the key message here was, it's time, end marriage discrimination. So this was the big ad that I was involved in, and the big campaign. And I'm just going to put my other screen back on. Hold on a quick second. That I was involved in to do work in the Labor Party. I then got involved moving and advocating as National Chair of Rainbow Labor to change Labor's position on a whole heap of issues. And this is just some of the material that we put out targeting internal Labor Party audience to shift their view into national conference. And we worked with the community to get lots of photos, and we ran, to Jordan's point early, a really concerted campaign across Australia and within the broader Labor Party movement to try and make change on marriage equality. I was called an activist. This is when I was a little bit younger. I'm now 36, so this would have been 8 years ago, I think, when I was still considered youngish. I was called an activist at the time, and this headline ran in the Daily Telegraph. So it was a full page in the Daily Telegraph with ALP stance is like so gay. We got quite a bit of media. Probably one of the best compliments I've ever received was from Michelle Grattan, who said I was the pincer that moved on Gillard over gay marriage, historically from my campaigning perspective. And a couple of photos there with Julian down the bottom and Andrew Barr up the top, who's Chief Minister of the ACT, who was very integral in our journey around marriage equality. And we rolled, and the campaign continued, and you can see me with Penny there and a whole heap of others as we continued to advocate around LGBTI reforms. And then more recently with Julia Gillard and both Kevin Rudd through Rainbow Labor and Australian Labor, where we had a really great relationship with Julia and Kevin. So what did we achieve? So, this is my story of why I became an advocate, and I was chair of Rainbow Labour for 7 years, so it wasn't a short journey. But across that time, we achieved some of these things that we got up on screen. So same-sex partners getting permanent residency, changes to migration laws, access to super and superannuation, statutory employment entitlements, recognition of Centrelink benefits, recognition of a family unit, reforms to ensure same-sex couples can offer tax concessions, access to rights under Department of Defence and Veterans Affairs, pre-op transsexuals and gender diverse persons carrying a passport of their preferred identity. We endorsed marriage equality, issuing certificate of no impediment to marriage. So, quite a few substantial wins through this campaign. All in all, it was about 36 platform changes and 200 pieces of legislation and regulation, over $100 million worth of funding across healthcare, health peaks, Medicare, mental health, aged care, funding and strategies in that space, justice, documentation, education, safe schools, certificate of no impediment for marriage, and religious exemptions. So this was a big part of my life. And yes, I was a volunteer, and yes, I worked full time, and yes, this was on top of everything else that I was doing. But it's an example of where if you get a small group of committed people together, you can really make a difference. A little bit about me to give you a little bit of context. I was kicked out of home when I was about 15. That's the year I came out. I almost crashed and burned at uni. I ended up studying law and commerce. I became a manager pretty young when I was 21. I teach at the University of New South Wales. I'll move to a small acreage this Thursday. I have an amazing dog called Milo and love my friends and family. And pre-COVID, I used to do a lot of gym and travel. So, my story is not that dissimilar to many of your stories, where you've got heaps on, you've got different priorities in your life, you've got lots happening, you may have had challenges through your life. It wasn't until recently in my life I came to grips with the fact that I was actually kicked out of home, and for a period of time I was homeless. Now I still feel uncomfortable talking about it. I was just like, I was just staying with friends for a long period of time, or quite a few months. But those parts of your past make who you are today, and your advocacy journey even stronger. So what I wanted to do is distill in all of the work that we're doing a couple of just really short, sharp hints and tips around how you can go on your advocacy journey and things that I've learned. So, you really need to work with politicians and the political framework if you want funding, policy change, or legislative change. And a big part about that is actually asking what you want to achieve and sort of aiming for what you want to achieve in that space. It's really important for particularly younger voices to have a seat at the table and be able to have participation and influence and negotiating power and get good outcomes and become a trusted advisor, because your views and voices aren't necessarily at the table these days. I jokingly started this presentation paying out the baby boomers, but I say that with all honesty, they have single-handedly distorted almost every political process in Australia to their own advantage. And the moment they pass that moment in time, they pull up the ladder so the next generation can't benefit the same way they have. Now, it's a really critical statement, but it's also an important one for you and your friends and colleagues and mates and associates to galvanize, because there is an opportunity within the next 10 years that the millennials, so Gen X, Y, and Z, of which you and I are part, will finally represent the majority of voters in Australia. And that has a different demographic opportunity on everything from healthcare through to climate change. A couple of really short tips that I've learned over the years: really remembering what's in it for the person you're meeting. Really start to think to some of the points that Jordan referred to over, who's got the biggest stick, what's the biggest frame, how can you beat people? Because reality, good policy, right intent doesn't really matter, unfortunately, in politics, and it won't make the difference. It's who can leverage and mobilize quicker. Remembering KISS, keep it simple, and remembering that electorates are critical. Some electorates in Australia are won or lost by 50 or 100 votes. I lost the first time I ran for Parliament by 32 votes. Now, that means if 16 people had voted differently, I would have had a different trajectory. So, small numbers do make a difference on electoral scales. Do some stuff, and we'll cover this in all of the formal discussions with CHF, but, use your social media to engage. Think of opportunities to attend events, and think about when elections are to ask and advocate for the things that you're passionate about. In more simple terms, and this is pulling apart all of the conceptual theories and everything else in between, these are 4 or 5 hints that I've used through a journey of advocacy and campaigning that's been a large part of my life, both paid, unpaid, volunteer, and everything in between. being on time, keeping a diary, write lists and tick things off. It's amazing what small achievements can have an impact on how you portray yourself and how you achieve something. Ditch something that doesn't matter. I don't really watch TV, and you need to ditch something that doesn't really matter in order to achieve what you want around advocacy and campaigning. And always find some time for me time or time for you to reflect in that space. If you're one that likes a more formal structure, I've given this to a few people before. It's the framework that says prioritize, organize, stream, economize, and contribute. If you're the sort of person that likes this, I think this pretty much says exactly what I said over Neil's rules, but in a much better explained way. And of course, that's my dog Milo up on screen. He's actually sitting below my feet at my desk at the moment, as he does, and he's very cute and likes to snuggle. But some people like images and some people like text, so I wanted to throw them in as well. I'm just going to finish off with, and somebody said show us the dog. I will pull the dog out once I've done my presentation and you can say hello to him. I'm just going to showcase something to all of you. And normally I do this interactively, but I know there's quite a few people on the call, so I won't. So you guys are already being impacted by highly manipulative campaigns already, and you often don't realize it. So this is where you need to get smarter around your advocacy. So the one example I use over psychometric campaigning is the FedEx logo. Now, at this moment, you're like, right, Neil's lost his plot for this evening. He probably needs his gin and tonic or wine to wrap up the day. But when hundreds and hundreds of surveys have been done about, when people see the FedEx logo, what do they think? And people will either answer in two categories. They'll talk about sort of trucks, planes, buses, the things that move parcels and the things that move delivery. Or they'll talk about words like fast, quick, prompt, efficient, things to do with moving quickly. Now, the really interesting side of it is everyone who thinks fast, quick, prompt, efficient has actually been under the guise of psychometric campaigning, in that there is a hidden message in the FedEx logo. And this is where you're like, Neil's lost the plot. The FedEx logo has a forward-facing arrow in it. Now, up until I pointed out that forward-facing arrow, you guys never would have seen the forward-facing arrow. Now that I've pointed it out, you're never not going to be able to see the forward-facing arrow. But the subconscious of your brain has seen that arrow every time you see the logo, and it actually distorts your perception of FedEx. Now, this is happening more and more and more. It's a specific science in political marketing called neuromarketing or neuropsychology, and it's a really interesting space to jump involved in. So a couple of final things. I think this is my penultimate slide. At this moment in time, everybody's like, I'm really busy. I've got heaps on, life is challenging. Life is hard. I sit on 5 or 6 boards. I work in a couple of different jobs. I'm always busy and doing things manically, but we all have the same number of hours in the day as Helen Keller or Michelangelo, Teresa, Leonardo da Vinci, Jefferson or Einstein. So, busy people have a tendency of finding time, and that's probably my lasting thought that I'd leave you with. Apart from jump on the Spark website, I've written a paper called Beyond Government Relations, which might be quite cool if you wanted to read it as well. So I'm going to stop my share there and jump back to my normal screen and see if there's any questions or queries. But before I do that, I did make a promise to get the dog. So hold on a quick second. I'll pull him out. He won't be too happy with me because he was happily asleep. But this is little Milo. He's a little Italian greyhound. He's probably been my best friend for the past 3 years, and he definitely keeps me company during the day and when I'm working away. So I'll tuck him back in, but he is a little cutie.
Thank you so much, Neil, for sharing your advocacy journey with us. We have a few questions from the chat. The first one is, as a young LGBTQIA person, do you have any advice around advocating about very personal issues when they are not accepted by other people or parties in the room?
It's a very tough question, and you need a lot of self-confidence to do it. So, my mum's family originally came from Italy, and so she grew up in a culturally and linguistically diverse background. And, she struggled a lot of the time to bring those stories to life because of the fear of the consequences that would have. For me, I developed quite tough skin during the marriage equality campaign. Like, I would have to go to groups that really didn't like what I was standing for and advocate for LGBTI rights. The interesting thing that I found, and the best way to resolve that, is to try and find a sense of common humanity that we share with the group, even if they dislike who you were. And the example of this is, I've done a number of presentations and have done a bit of work for Catholic Commission in Australia. Now, I'm atheist. I'm a gay rights activist. You know, the Catholic Church has been the biggest blocker around a lot of LGBTI reforms, and yet I've worked with the Catholic Church. And when I worked out and presented to them, I'm like, you know what, guys, I'm a gay rights activist and you don't believe this. You know, I'm pro-choice. You know, I'm very pro-choice around women's reproductive choices. And I know you don't agree with that either. So I'm like, let's just park that and agree with the things that we can land on. And that is things like, you know, the opportunities for a better society and alleviating poverty and, you know, improving outcomes for disadvantaged Australians. And I found that by declaring my differences, but also declaring our similarities, we were able to form a really good working relationship. And the most I can often hope for is they'll just be neutral on issues as opposed to actively opposing. But finding our common humanity is probably the one thing that I'd really recommend in that space. Even with your most critical enemy, you can usually find something in common.
We have another question. So Parliament doesn't have much youth representation, and this has discouraged a lot of young people from taking part in politics. How should political parties adjust to engage young people in the political process?
So this is a bit of an interesting one. I first ran for Parliament when I was 29 for a state parliamentary seat in Victoria, and I was unsuccessful, but I was one of the youngest running. I was also the only out LGBTI candidate in the field. Victoria still hasn't elected an openly LGBTI parliamentarian to the lower house. So, you know, we are still behind in that regard. It's a real challenge because I think the political parties, despite my membership of the Labor Party, are really behind the times around diversity. You know, the Labor Party is much better, for instance, than the Liberal Party, which has very few women and no people of cultural and linguistical diversity backgrounds. But it's really hard for young people. So this is one of these questions where, you know, I've slammed my head against the wall and I've tried and I've been unsuccessful in getting elected. But with that said, by me doing it and getting close, you do get letters of support of people who are like, you know, it's emboldened me to give it a shot. And I suppose you've got to be in it to win it. So, you know, a bit of a thick skin, but also recognizing that, you know, I couldn't get elected to Parliament on the couple of attempts I did. But if I've created a space for other young or other LGBTI people to get in after me, then that's kind of my job done to an extent. So sort of thinking about others, not just yourself, probably.
We have another question. So currently the government is working on the National Youth Policy Framework. What would you like to see reflected in this framework?
I think the big thing I'd like to see reflected in that framework is, I'd probably say three things. The first is the government federally doesn't put things into the framework that it doesn't like the sound of, even though they might be the most pressing issues. So I'll give you an example of this in the health space and around young people. When it comes to suicide, the highest individual demographic as a proportion that has high incidence of suicidality is transgender Australians. You'll see no mention of them in any suicide policy ever put out by any federal government because they don't like to discuss transgender people. So, you know, the first thing that I'd like to see in these sorts of policies is a government that is big enough to put aside the fact that, you know, they have specific issues and actually mention some of the root causes. I think the second thing is put money where their mouth is. You know, there's all of these policies that come out and then they never resource them. And that would kind of be my second point in that space.
So thank you so much. Unfortunately, we don't have enough time to ask more questions. But we really appreciate your time being here today to talk to us about your journey in advocacy and so many important tips that will help so many young people in their journeys through advocacy. Just to wrap up, if you'd like to learn more about the Youth Health Forum, please get into touch with Carolyn. She'll post her email address in the chat right now. It's also available in the event webpage if you need it. Additionally, just letting you know, we have a few more webinars scheduled for the rest of the year, one on effective communications and another on research to inform advocacy. So please don't forget to register and send your questions on time.
Thank you for that. I've just shot out my Instagram and Facebook. If I didn't get to answer your question as well, same as Jordan, I'm regular on Instagram and Facebook, LinkedIn and Twitter. So it's just Neil Farrow at all of those, and happy to help. And from many of the CHF members, I'll be speaking to you and working with you over the next few months as well. So very big thanks to Zinab and Carolyn and the team as well.
Thank you, Neil. Thank you everyone for coming. Speak to you all soon.